Hi everyone, I'm Teresa. I'm the nurse injector at our Music Row location.
And my name is Olivia Gibson. I'm one of the nurse injectors at the Mount Juliet office. Teresa and I are here today to talk through what a consult and treatment look like with Botox and Dysport.
So we are each going to consult with a patient today. We have a male and a female patient. We will come up with a treatment plan and go ahead and inject them.
Botox and Dysport are neurotoxins that relax the facial muscles and reduce the appearance of fine lines and wrinkles. Typically it takes about 2 weeks for Botox and Dysport to kick in. So Teresa, do you want to tell us what today is?
Today is exactly 2 weeks before our open house, so we'll be able to see the full effect of the treatments that we do today.
All right, let's get started. So why don't you look in the mirror and tell me where you would like to treat today, Angela?
So forehead would be great, and all over would be great. But I know there's areas. What would you recommend first?
Yeah, absolutely. Okay, so the forehead. I see all of these lines in your forehead. Mm-hmm. So those are created by raising of your brow with your frontalis muscle. It's a flat muscle on your forehead. The frontalis muscle lifts your brow, so when we inject Botox, it will relax it down. Mm-hmm. So if I were only to treat this frontalis muscle, you would feel pretty heavy here. Mm-hmm. So we'll definitely treat this group of muscles here called the glabella. Can you frown for me? Make a mean face. Yep. Okay, so you can even see your muscles here, your corrugators pull in. So we'll treat those too. And then smile really big for me. So you've got a bunch of great smile lines around your eyes. We'll soften those with some Botox today. The thing with you have like static lines, meaning at rest, you still have some lines in your face. So it may not be one treatment to kind of cure it all and get rid of those lines. If you were to stay on top of your Botox treatment, like do it every 3 to 4 months, then maybe after a year we could soften those lines and maybe make them go away completely. One treatment will soften it and you should see a result. The other thing with you is you are using your frontalis muscle just at rest. You're kind of lifting your brows up because you have a little excess hooding on your upper lids. So you would love an upper blepharoplasty at some point in life.
That would be ideal.
But in the meantime, what I want to do is not treat your frontalis muscle too much because you're just not going to like that. You're going to feel very heavy and you use that muscle all the time to raise your eyebrows up. So we'll just be gentle there and try to treat well around your crow's feet, because sometimes this muscle that wraps around your eye, the orbicularis oris muscle, it's a sphincter muscle that kind of squeezes in. So when we inject Botox there, hopefully it will relax up and out. And we could get a little bit of a brow lift with you, which is always a plus.
Great.
So what I'll do is I'll feel your muscles and I will mark you, and then I'll go get it drawn up. Okay?
Great, thank you.
Awesome. We've got some strong muscles over here, and relax and ready to give in. Perfect, and relax. All right, I will go get that drawn up and I'll be right back, okay?
Thanks.
Frown for me again and relax. 1, 2, 3. Perfect, great job. Frown again for me and relax. 1, 2, 3. And frown again and relax. Good job. So if you had had a glass of wine the night before, or taken Motrin or Advil or anything, you may bruise. But you really shouldn't with Botox. These can sometimes make a little crunchy sound. Good job, Angela. You did amazing. I'll see you back in about 2 weeks. Okay. These little blebs on your face will go away in 15, 30 minutes. You can put makeup on in about an hour or so if you needed to. Rules for after, so you don't want to lay flat for about 4 hours. It takes about 4 hours for Botox to bind to the muscle. So don't exercise the rest of the day. Don't lay flat for the next 4 hours. Don't wear a hat or any constrictive band. Pretty much I want it to go where I put it, and not anywhere else, okay?
Okay, great.
All right, thank you so much. You're a great model.
Oh, thank you.
So have you had Botox before?
Yes, but it's been quite some time.
Okay. So what areas do you usually do?
Forehead, crow's feet, my little bunny sometimes,
right through
and
here.
my 11s.
Okay, perfect. So, Botox works, of course, by relaxing those muscles that make the deep lines here, that pull your brow down, that make the crow's feet, and that make your bunny nose. So we'll relax all those muscles today by putting some Botox in there. Botox doesn't work today. It takes about 5, 7, 10 days before you see that full effect of your treatment. So on a man, the muscles are just stronger. So you've got a very strong muscle through here. Frown for us. Yeah. So typically men need a good bit more Botox than women do. But just to relax those muscles a little bit more. You don't ever also want to put too much in their forehead because those are the lifter muscles. And if they can't lift at all, their brow gets mighty heavy. A man's brows sit lower than a woman's do anyway. You don't want to feminize them by elevating too much and making them look unusual. So anyway, we're going to get going on that right now. Okay, so just rest your head back there. I'm going to clean you off a little bit. Your only restrictions today will be to stay upright for about 4 or 5 hours. You don't want to bend over like this because who knows where that Botox is going at that point. And don't do anything bouncy either. We don't want anything to come down to your upper lid. That's the muscle that opens the eye, so don't want anything to go there, okay?
All right.
So that's really the only restrictions, and that's just for today. Tomorrow you can do whatever you want to do, okay? Awesome. So let's get going here. Okay, and relax that. We'll make us a stick right here. Is this okay?
Mm-hmm.
And the same on the other side. Good. Now frown again. Relax that. And I go above this eyebrow. Sometimes that one hurts me a little bit, which means this one will too. Frown again. Relax. Brows really high. Relax that. I'm going to start in the middle here and work my way up. One more raise. Okay, good. Good. Yeah, raise your eyebrows again. Relax that. Way over here. One more raise. Or actually a couple. Okay. And one more time. Good, relax. Right there. So that's little small amounts up in your forehead, so we'll get those to, just by spritzing around, hopefully get those lines evenly relaxed. Let's do some bunny nose, okay?
All right.
So, scrunch your nose up. Perfect, relax that. Right here. And, perfect, relax. Right there. Good deal. You also want to rub up today, okay? Just rub away from that eye.
Okay.
And let's do some crows. Again, relax. There. Again. Okay, good. Right there. And lastly, perfect, relax. Right there. Good deal. All right, so that's that. Let's get you cleaned off a little bit.
Barely even feel it.
Good.
And we're back, and I hope you enjoyed that video as much as we did, and we want to talk about all the results that we're going to see here in just a second. I'm especially excited to see the male patient because a lot of folks think that Botox is only for women, and that's not always the case. Men also need a little Botox in their life. So before we get started, I do want to introduce our two ladies here. We have Teresa Safford over here on my left, or your left as well. Teresa has been in the aesthetics world for over 20 years. Teresa has worked in the operating room. She's directed an OR. She's worked in the clinic, in the plastic surgery clinic. She's also been doing injecting. I bet everybody out there, Teresa, probably even knows who you are because you have so much experience out there. So we're super excited to have you, and you're an incredible injector, and we're very grateful to have you aboard. And she works out of our Music Row office. And then on the end over here, we have Olivia, last but not least. Olivia has been with our practice for since 2018. Olivia started working in our clinic to understand how the face works, how the muscles in the face work. She took that knowledge and applied it to injectables and now has become this incredibly gifted, artistic injector that I've actually let inject my face. So I am super proud of that, and I'm super proud of you for everything that you've done. So without further ado, we're going to get the show started. So let's talk, Olivia, we'll talk first about your patient. So tell us about this lovely patient.
Yes. Okay. So this sweet lady came in just wanting, a refreshed, that's what everyone wants, a refreshed, natural look. She was an interesting patient because she wanted to treat the lines in her forehead, but her brow and her upper lids are just a little low. So we had to really dose that pretty lightly. But we were able to give her a good lateral lift in her brow to kind of elevate and then soften the lines around her eyes and in between her brows. And she got a great result.
So, Olivia, I want to bring something up real quick because I think that's an incredibly important point to hit upon, which is what you just mentioned. That sometimes if you don't treat lighter for folks like this, for instance, you can cause for their brows to drop, and then it can make the hooding over their eyelids look much worse.
Right. So she had, static lines or lines that are deep and they're still there when she's not animating. And we talked about that beforehand, that she may not be able to get rid of those lines completely. A lot of times you need multiple treatments. You need to come in every 3 to 4 months, stay on top of it to really get that smooth appearance, especially if you have the static lines.
Right, and so you can see a great difference though, even though you didn't do heavy in the forehead, there's still some softening of those lines.
Absolutely.
So tell me, Olivia, how are you going to deal with a patient that's going to be scared or nervous?
Just take deep breaths, walk through it. It's small little insulin needles, so less than a bee sting. It's very quick. Normally we get done and they're like, is that it? And that's the goal. And then they, move on with their day.
Yes. And then also talk to us. We get a lot of questions on the phone. Y'all know I'm on the phone. Also, if you have any questions out there, you can type them in on your screen and ask us any questions. But tell me about the safety of Botox.
Oh, very safe. It's been around for 20 years, FDA approved. We've, obviously been doing it for a long time. They actually use Botox with like cerebral palsy and babies. We're doing more cosmetic cases here, obviously, but a very safe and effective drug.
Right, very safe. That's great for all of our patients to know. We're not going to do something that's going to hurt you. It's not going to hurt you.
So Teresa, let's turn to you. Let's talk about your patient that you injected. So tell us about your injections and what we've accomplished.
Yes, for a male, it's just a different story. They're a different breed. Muscles are stronger. Muscles are stronger. They, I still do the same pattern as I would in a female. He wanted to get rid of some of the forehead lines, which I think we accomplished nicely. He also has some of the static lines, Olivia, that you mentioned. But they're much softer. He's maybe not raising quite as high as he was before, but he can be surprised. He can have an expression.
Teresa,
that's what it's all about.
That's a very good question, and I think that's something that, for instance, Olivia, when I came to you asking about that, as a male, I don't want to make my face be completely flat, be completely smooth, and not be able to show the ability to animate my face.
Right.
You still want to retain some movement of the muscle, but you want to get rid of some of the coarse lines that you find, especially crow's feet out here around the outside of the eye, and especially over here around that glabella. So tell us about your approach to that. How do you dose differently? Tell us about that.
Use a larger amount of Botox. Men just simply take a larger amount of Botox. Same pattern, you're putting it in the same place. A lot of men will come in though, and all they're concerned about are the forehead lines. They don't care about this little frown that they have. This is what they want gone. Well, these are the lifter muscles, and you can't simply dose there or they will be unable to raise
It's a
their
great
forehead.
visible that you just did.
Yeah, Teresa, look at that.
There you go.
Look
Okay.
at this.
That's good.
Yes.
Love it.
So that's him frowning, obviously, in the before. And you can see he can still be concerned, which is the hugest thing. You don't want to tell someone some horrible story and they just, they can't express.
Right.
Yes. So I think that's beautiful. He's definitely still got expression.
So for a lot of folks out there who we are, with COVID over the last couple of years, we're all wearing masks, and those masks cover up our faces. And then by not being able to express yourself, your patients or people around you might not know if you're laughing at their joke or not laughing at their joke.
Have no expression.
Right. So that's important. So you did a fantastic job.
He's thrilled.
I wanted to just ask y'all maybe both a question. Botox is a term it's used a lot. Botox is just one type of neurotoxin that we have available to us. Dysport is another. Talk to us about the two neurotoxins and maybe talk about your experience with them. Is one better than the other? Tell us about that.
I have for many years, when Dysport came out, they're both botulinum toxins. They're just made from a different protein. Same action, they're making the muscle not move. And
over years, sometimes people can become acclimated to one a little bit more than the other, and we may want to switch at that point. I have, rightly or wrongly, many times called it Betty Crocker and Duncan Hines. I mean, they're both toxins. They're both going to do the same thing, and it's just really a patient preference.
Right.
Very, very individualized.
Krispy Kreme and Dunkin' Donuts.
There you
There
go.
you are.
Coke
Those
and
are really
Same
good.
thing. Both really,
Really
good
good.
donuts.
They
but
are.
sometimes you just get a craving for something
For
else.
something else.
So, and we've seen that. We've seen that happen to folks that they build up a little bit of an acclimation. It's a great word that you used earlier, and at that point, that might be a good opportunity to switch and try something different. But folks need not be afraid that, oh, well, I didn't get Botox, I got Dysport, or I got Dysport, I didn't get Botox. So that's
So
a
I
great
have
point.
some questions coming in from some of the viewers out there. And so somebody asked, what if I didn't know the areas that I needed to treat? How are you going to deal with that?
I think we probably both would hand them a mirror, sit down in consultation and say, tell me what bothers you. Because I might look at them and say, oh, we want to go here, you know, and that's not what they're concerned about, you know, or whatever. So I'll just hand the mirror. What's bothering you? What brought you here today? What do you want to make look better?
Olivia, is that
Yeah.
the same approach for a new patient coming in to see you, for instance? Is that how you approach
Absolutely.
them as well?
Yeah, I hand them a mirror and then we look together, and I'll comment on things I see and
Yes.
something that maybe can help them that maybe they haven't noticed or it can work in conjunction with the area that they're concerned about. But absolutely, it's a group effort. We're a team, and we're going to give you the best results
right.
together.
Right.
Another quick question. So
Right.
patient comes in, they get a treatment, and they're like, wait, they're walking out, checking out, and they're like, I'm still moving my face. How long does this stuff take to kick in?
Great question.
When should the patient be looking for an actual result? When does that happen?
About 5 to 7 days is normal, time of kicking in of the Botox or Dysport. Dysport maybe is a little sooner, but 2 weeks is full effect. And so at that 2-week mark, we always like to see patients back in so we can, check, make sure everything looks good, add more if we need to, and correct anything, and just see how beautiful you look.
Are there restrictions that y'all put patients on after the procedure,
Great
after the
question.
treatment?
We do. Ask them to stay upright for 4 or 5 hours. The muscle that opens your eyelid sits right in here, and so it's important that nothing gets rubbed down toward that. I ask them not to bounce, not to work out that day, because you certainly don't want any complications. The only thing I really worry about, probably mostly, is a bruise, but the bigger complications would be a drooping eyelid or a heavy forehead, which is why you don't dose too much, like on your patient. You watch this forehead amount, and just ask them to stay upright. Don't bend over for a few hours.
And then they're good
And
to
then
go.
they're good to go till that 5, 7, 10-day mark when their Botox kicks in.
Right.
And they look in the mirror and they become happy.
And they can exercise and do all their
everything
things.
the next
All-
day.
The next day.
The next day.
Well, tell me this. So we've had a question. Somebody asked, how can I make sure that I'm going to get Botox and still look natural?
Natural is what it's all about.
Yeah, I think that's the name of the game.
yeah.
Refresh, natural,
Great.
relaxed.
Great.
There are many people, young girls, I think some of the really younger girls who they don't want their forehead to move at all. And I try to dissuade them a little bit from that. I want just them to be able to be surprised. You've got to be able to do that a little, but they'll look natural.
Right. Well, that was such a great and informative presentation. Thank you both so much. You're excellent nurse injectors. Remember, Teresa is at our Music Row location. Olivia is at our Brentwood and our Mount Juliet location. If you're wanting to schedule a consult or talk with one of them about Botox or Dysport or any of our injectors, you can call in at our office, 615-771-7718. And remember, we have one number for all of our locations, so call in and we can help you schedule for all locations.